All right. Good morning, everybody. My name is Jaquarius Jackson. I work with the Baylor Scott and White Health Plan as a wellness advisor too. Thank you all for joining our second webinar of the year. As today we'll talk about the C word, specifically talking about lung cancer. As a reminder, we do these webinars at the top of the Wednesday every single month at 11 o'clock, and we'll have our 30-minute session as usual today. We did bring in a guest presenter with you all today to talk about our topic that has a little bit more of a specialty in the area. And I will let our guest presenter go ahead and introduce themselves.
Good morning, everyone. My name is Ashley Cleveland, and I am a nurse practitioner that specializes in the workup of lung nodules that sometimes turn out to be lung cancer here at a local hospital where I live in Nashville, Tennessee. It is truly a pleasure to be able to speak with you all this morning regarding lung cancer. Jaquarius, I am ready when you are.
All right. So we'll kind of get started here, guys. I'll advance over to the next slide. As a reminder, we do encourage you guys to be as interactive with us as possible. We do have the three chat bubbles down at the very bottom. In those three chat bubbles, you guys do have a chat option there, or you can use the round circle chat option as well to either write notes to myself or any one of the panelists as well. Then Ashley, whenever you're ready, we can go ahead and get started.
Alrighty. So this morning we'll be talking a little bit about a few facts about lung cancer. We will also identify any risk factors as well as any symptoms as it relates to lung cancer. We will then look at lung cancer screening and then some prevention tips for the prevention of lung cancer. And then finally, we will talk about some lifestyle care considerations to consider for individuals who are living with lung cancer. So here pictured, you can see the awareness ribbon for lung cancer, which is a white ribbon. Lung Cancer Awareness Month is every year in the month of November. So let's talk about a few lung cancer facts this morning. Lung cancer is the third most common cancer here in the US. However, it is the deadliest cancer amongst them all. Really briefly, because I'm not here to overwhelm you guys with any facts, but we have two different types of lung cancers. We have non-small cell lung cancers and we have small cell lung cancers. Non-small cell lung cancers are going to be considered the good lung cancers. Now, the reason why we consider these cancers to be the good type of lung cancers is because we love the way they behave. When I say we love the way they behave, these are very slow growing cancers. And when I say slow growing, I mean anywhere from 2 to 4 millimeters in a year. Since they tend to grow very slowly, patients don't tend to have symptoms, and we also tend to catch them early before they have the opportunity to spread to the lymph nodes in the chest as well as any other nearby organs. Non-small cell lung cancers are going to be your adenocarcinomas, squamous cell carcinomas, and large cell carcinomas. Thankfully, with these being the good type of lung cancers, they are also the most common type of lung cancers, affecting anywhere from 80 to 85% of lung cancer cases. Now, on the other end, we have small cell lung cancers. These are what we consider the bad lung cancers. The reason being is they're quite opposite of those non-small cells. These type of lung cancers grow very fast. I mean, they're growing by the month and getting larger. They tend to spread to the lymph nodes and nearby organs much more quickly than a non-small cell. These are the type of lung cancers that, if they are left untreated, they unfortunately tend to kill people. Thankfully, however, they're not as common. Only about 10 to 15% of lung cancer cases are going to be a small cell lung cancer. The American Cancer Society has a fact listed on their website as it relates to lung cancer. And what stands out to me the most is that more people die of lung cancer combined than those with colon, breast, and prostate cancers. However, if we catch any of these lung cancers, whether it be non-small cell or small cell lung cancers, most tend to respond pretty well to treatments and patients have better outcomes. So let's talk about some risk factors for lung cancer. The biggest and most important risk factor for the development of a lung cancer is going to be cigarette smoking. It honestly increases your risk substantially by about 20 times. So if you are a current cigarette smoker or a former cigarette smoker, you're going to be at a higher risk of developing a lung cancer. Individuals that are exposed to things out in our environment, such as radon, which is an odorless gas that is found in our soil, and asbestos, which is a chemical that was found in early building materials, some necessary parts, and things like that. Those individuals who have significant exposures to either radon or asbestos are also at a higher risk of developing a lung cancer. Other environmental exposures, such as secondhand smoke, although not as significant as cigarette smoking, secondhand smoke can increase your risk of developing a lung cancer. And then other things in the environment, such as diesel exhaust, other toxins, chemicals, fumes, that certain individuals may be exposed to depending on their line of work. Of course, genetics is going to play a factor with anything. Anytime an individual has a first degree relative, and in this case, a first degree relative is considered a parent, a grandparent, a sibling, or any children with a history or a diagnosis of a lung cancer, then that individual is going to be at a higher risk of developing a lung cancer. People with other lung diseases, such as COPD, emphysema, are going to be at a higher risk of developing lung cancers, specifically individuals with emphysema seen on their CT scans. Unfortunately, people that have experienced radiation therapy due to a previous type of cancer to their chest wall, they are going to be at a higher risk of also developing a lung cancer. So let's talk about some symptoms. Most patients with lung cancers do not have symptoms. Remember thinking about those non-small cells, the most common types of lung cancers that I discussed at the beginning. Since they tend to grow so slowly, most people don't have symptoms. If an individual has symptoms, it's thought that their cancer is going to be likely more advanced because, again, given how slowly they tend to grow, most people don't have symptoms. However, the most common symptom is going to be a chronic cough. Additional but later seen symptoms would be shortness of breath, fever, unintentional weight loss, which is losing weight without trying, cervical adenopathy, which would be swollen lymph nodes in the neck or the throat region, unusual fatigue, and hemoptysis, which is coughing up blood. Again, most individuals do not have symptoms for lung cancers. If they do, it's typically going to be a cough. Their considerations for individuals living with lung cancer. Not anything specific to lung cancer, but just overall maintaining a healthy lifestyle. So we encourage all of our patients who are diagnosed with lung cancer to maintain an active lifestyle. And that means being as physically active as they can be. If someone can work to get at least 3 days of physical activity, at least 30 minutes a day, 3 times a week, that is ideal. If someone can do more than that, that's going to be even better for the patient. Of course, we recommend following a balanced, healthy diet, including a diet that is high in vegetables, protein, fruits, whole grains, and limiting things such as alcohol and unhealthy foods that are high in fat. We, of course, also recommend for patients with lung cancer to avoid additional exposures to things that we know are harmful and can contribute to the development of a lung cancer, such as secondhand smoke and, again, asbestos. So let's talk about screening. And I won't go too in detail on this slide because I have another slide discussing this as well. But how do we screen patients that are at high risk for lung cancer? Well, we do that through what's called annual lung cancer screening, or some people call it a LDCT, which is a low dose CT scan. And individuals who qualify for that are encouraged to undergo this annual screening. A low dose CT scan is similar to a standard CT scan, but the key difference is that it does not emit as much radiation as a standard CT scan. So patients aren't going to be exposed to as much radiation with a low dose CT scan than they would be with a standard CT scan, which is why we then recommend high risk individuals to have this annual low dose CT scan once a year. Thankfully, all insurances, including Medicare and Medicaid, will cover these screenings because it is a recommended screening by the U.S. Preventative Services Task Force. So, if you think that you could qualify for lung cancer screening, I would encourage you to reach out to your primary care provider or whoever you go to for your healthcare needs. Because what we do know is early detection is key and significantly improves survival outcomes in individuals that have lung cancer. If we catch the cancer early, we stop it from being able to spread to other areas of the body. And then, most cases, if the patient is a good candidate to have surgery, we tend to just go in and surgically take that lung nodule out, and we actually end up curing the patient of the lung cancer. But we cannot do this if the cancer is caught too late and has had the opportunity to spread, or if the cancer is a small cell. We only recommend surgical intervention for individuals who are diagnosed with non small cell lung cancers. And so, how can we prevent the occurrence of a lung cancer? Of course, the biggest risk factor alone is going to be cigarette smoking. So, if you smoke cigarettes, I would encourage you to consider quitting and then also consider reaching out to someone to get resources to help you with quitting. And nicotine containing products such as vaping, hookah, cigars, those all contain nicotine, which then can still put an individual at a higher risk of developing lung cancer. So if you're using any of these products, such as the vapes, the hookah, cigars, I would also recommend that you reach out to someone for some resources so that you can work on hopefully quitting those habits. Enrolling in annual lung cancer screening if you qualify. And we'll talk a little bit about what qualifies someone for annual lung cancer screening here in a second. So, if you're a high risk individual and you qualify, the best thing to do is to enroll in this screening, because the only way we're going to be able to see it is if we actually are screening these patients with these CT scans. If you live in an area that you're not sure that may possibly have radon, I would encourage you to have your soil tested and make sure that that's not available. And if it is, having it treated. The same thing with asbestos. If you live in an older home, most homes built before the 70s, they were still using some asbestos containing materials in the 70s, but not so much as they were pre 1970. So if you live in an older home, I would encourage you to have your home tested for asbestos. And again, if it's positive, having your home treated for that. Of course, avoiding secondhand smoke exposure. You want to try to avoid areas where people are going to be heavily smoking and you're just constantly inhaling that secondhand smoke. There are some resources listed across the bottom of this slide that are free and available to you. The first one is the national hotline 1-800-QUIT NOW. This is a phone line that has individuals who are ready to discuss with you if you are a current cigarette smoker or using any of those other products such as vapes, hookah, nicotine, and they can provide you with resources and counseling to assist you in your quitting efforts. There is also a Quit Start app that is available and free on the Google Play Store as well as the Apple Store. It is more tailored to the individual, so it allows you to make an account, set up a quit day, and it also quit date. And it can also, again, provide you with resources depending on where you live. Like I mentioned earlier, the U.S. Preventative Services Task Force, they set the recommendations for pretty much all of our guidelines. And depending on what grade you get, that determines how strong of evidence is available and how much we should basically trust the recommendation. So the recommendation for lung cancer screening is a grade of B. So we know that early detection of lung cancer significantly improves survival. So we recommend that for individuals that are high risk and who qualify for annual lung cancer screening to undergo this annual low dose CT scan that is available for free to you once a year. You have to be at least 50 years of age and ideally no older than 80, because once you turn 80, nobody's insurance is going to pay for it. I also would like to say if you have Medicare or Medicaid, they also do not like to cover it after you turn 78. So most patients that turn 78 will phase out unless they're still for some reason on a private insurance. You also have to have a 20-pack year smoking history and be currently smoking or have recently quit within the last 15 years. So what is a 20 pack year history? Well, that's a simple math equation that we use. We basically say, so if I'm seeing the patient John Doe and he's 55 years old and he tells me, okay, Ashley, I quit smoking 5 years ago and I think I qualify for this annual lung cancer screening. Can you verify that for me? So then I would ask him, okay, you quit smoking 5 years ago. How long have you been smoking until you quit? And then at your heaviest during that period, how much did you smoke a day? So say he tells me, okay, well, I smoked for about 20 years because I started later in life. And at my heaviest, I only smoked 1 pack per day. So if he smoked 1 pack a day for 20 years, he has a 20 pack year history. If he smoked 2 packs per day for 20 years, then he has a 40 pack year history. So the more you smoke a day in pack wise, the higher your pack history. Most people don't tend to smoke more than 1 to 2 packs a day. There are some people who do smoke 3, 4 packs a day, but those typically are people that are doing some type of job like truck drivers. I see a lot of truck drivers personally, and they're able to smoke about 4 packs a day because they spend so much time sitting in their cabs driving. So if you have at least a 20 pack year history and you're at least 50 years old and you recently quit smoking within the last 15 years or you're currently smoking, I cannot stress how important it is for you to enroll in annual lung cancer screening. Because, like I've been saying since I've started this presentation, the best thing is to catch these lung cancers early, because early intervention will significantly improve the outcomes in individuals who have lung cancer. Now, why do they stop it at 15 years? Well, what we found is that the likelihood of you developing a lung cancer is highest when you're currently smoking or within the first 15 years after you quit smoking. After 15 years, your chances of developing a lung cancer are significantly lower, which is why they don't recommend any additional screening after you hit 15 years. Again, the recommendation for these non-small cells, which is why we screen patients, is to surgically take it out. Because once we surgically take that lung nodule out, the patient is cured of their lung cancer. And then from there, all they have to do is undergo CT scans for about 5 years to make sure that the cancer does not reoccur. Takeaways. Again, early identification of lung cancer significantly improves survival outcomes. If you even think that you might qualify for even a year or two, I would recommend that you reach out to your healthcare provider so that you can get enrolled in this screening. It's not going to cost you a thing. The CT scan itself takes anywhere from 2 to 5 minutes. It's quick, it's in and out, and they're looking for any suspicious lung nodules as well as any large lymph nodes. And if we catch something early, again, we can intervene and significantly improve those outcomes. Annual lung cancer screening is available to high risk individuals who are at least 50 years old and meet the 20 pack year smoking requirement. So you have had to smoke at least 1 pack a day for 20 years or smoke more packs a day for a short amount of time to likely qualify. If you are a smoker, I would encourage you to consider quitting. I don't have to sit on this webinar and tell you guys about the negative effects of smoking and what smoking can do to your lungs, because I'm sure you're aware of that if you are a smoker. But if you have even the slightest inkling of, hey, you know what, I think now might be a time, or I would consider possibly quitting in the near future, I would recommend for you to reach out to your healthcare provider and obtain some resources. Baylor Scott and White does have a tobacco cessation program. So if you are a smoker, I would encourage you to reach out to them so that you can then get some help with your cessation attempt quits. And that's all I have for you guys this morning, and I will now take any questions.
All right. Ashley, I'll help you out with some questions that we did have come through in the chat.
Okay.
The first one that we have here, does air pollution and factory pollution also contribute to people getting lung cancer?
Yes, they do. Although not as significant as, again, cigarette smoke or radon or asbestos, you notice that it was probably a little bit farther down that list. It does contribute. So when I find out that, like, I see a lot of people who work in coal mines and work in different type of plants creating certain things, And my question to them is always, do you wear PPE at your job? Are you wearing masks? Because most people will say no, but if you know that you're constantly being exposed to toxins and chemicals at work, or if you live in an area such as like Los Angeles with these recent wildfires, the recommendation would be for individuals to wear respirators and masks, ideally a respirator and not a standard droplet mask, just to filter out those harmful particles that you may inhale.
Okay, thank you for that. Our next one is smoking marijuana the same as smoking cigarettes? Could it also lead to lung cancer?
So currently, there aren't any clear indications that marijuana increases the risk of developing a lung cancer. However, as a pulmonary nurse practitioner, I can tell you that smoking marijuana is just not going to be good for your lung tissue and your lung health overall. So while it won't increase your chances of developing a lung cancer for what we know currently, it would be beneficial to quit that habit if that's something that you are dealing with.
Okay. And then it looks like we have one more. Let me see. Um, is there possibilities that they may decrease the annual screening age given there are more concentrated amounts of nicotine in vapes and hookah? What can a younger person do if they suspect cancer and that they're below the recommended age?
So that's kind of like a double question. So the
Yeah,
first part of that question was, would they consider bringing the age down? So I'm
correct.
going to address that first. So what I will say is that the American Cancer Society now about what's 2025, 2 years ago, so I think the fall of 2023, they actually upgraded their recommendations. Now this is the American Cancer Society, not the U.S. Preventative Services Task Force, um, the USPSTF. So the American Cancer Society said, hey, we actually recommend that not necessarily that you drop the age to about 45. And then they also recommended that you do lifelong screening. So they want people screened for the duration of their life. However, it takes a while for those recommendations from organizations such as the American Cancer Society to then be reflected from the U.S. Preventative Services Task Force. So until the USPSTF updates their guidelines to reflect that recommendation, currently it's still going to be 50 to 80, but we do anticipate over the next few years that they likely will make some adjustments to the recommendations. But of course, that's going to require more literature, more research to then justify bringing that number down, and then also possibly including screening for the duration of someone's life. Can you remind me of the second part of that question? Something about
Absolutely.
vape and nicotine.
So what can this younger person do? So maybe they do currently vape or use hookah, and suspect that they may have lung cancer, but they are below the recommended screening age.
So as always, if you have a pulmonologist, I would definitely follow up with them. If you do not and you follow with a primary care provider, I would recommend reaching out to them and seeing them and then kind of talking to them. Because again, most people with lung cancer develop this like chronic cough. And most people, honestly, they're like, oh, I just have this little hacking cough. It's been going on for a while, and they just kind of brush it off. And if you're having a cough that has lasted for more than 3 months, that's not normal. It could be a lung cancer, but it could also be something else, whether it be allergies, poorly or undertreated asthma, poorly or undertreated reflux. So my recommendation is if you're having any type of pulmonary symptoms and you're under that threshold, that you reach out to your PCP and go have that worked up, because anybody can get a regular CT scan of the chest, right? They probably would say, okay, well, let's get a chest x-ray first. If the chest x-ray doesn't show anything, then let's get a CT scan of the chest. So that's usually how I end up seeing patients in my lung nodule clinic who are below that 50 years of age, because they tend to get a CT scan for another reason. Whether it's, hey, I'm having pulmonary symptoms, whether it's, hey, I was having abdominal pain, they did an abdominal CT scan, caught the bases of my lung, they saw a nodule, and now I'm here. We typically do not find these lung nodules unless someone is enrolled in annual lung cancer screening. Outside of that, most of them are typically caught incidentally. And what that means is someone gets a CT scan again for another reason that has nothing to do with their lungs. And then they say, hey, XYZ, but also here's a lung nodule. So if you're having any symptoms of any kind that linger, I would again encourage you to reach out to your primary care provider so that you can have some additional workup that could potentially include a CT scan of your chest.
Okay. And then a final question, Ashley. What does the screening for lung cancer look like? Or kind of like a painted picture of it. Maybe
Mhm.
someone is like in that eligible group, but maybe they're like scared to go get screened. Maybe they think it's like an intrusive process. Can you
Yeah.
like kind of paint a picture what that would look like for them if they did go get that done?
Yeah. So a CT scan itself is really easy, guys, and you don't need any contrast. So most people are kind of like, I don't want to have that IV or, the contrast ruins people's kidneys, which contrast is pretty hard on the kidneys. But the good thing about lung nodules and looking for lung cancer, we don't need a CT scan with contrast unless we already know that your lymph nodes are big in your chest. We can see what we need with a standard CT. Now, a standard CT scan, like I said, maybe 2 minutes max. They put you in that little donut hole of a device. Your head is going to be outside of that hole, and they're just going to bring you in feet first. You're going to go into the little donut hole, and then they'll tell you to breathe in, hold your breath, shoot the picture, and then you'll come right back out. So it literally takes no more than 5 minutes. You don't need any IVs, so there's no contrast. Here at my facility, what we do for our annual lung cancer screening, it's all pretty easy. Patients don't have to see anybody. They do a phone call visit with one of our nurse practitioners and they get their history. They order the CT scan. The patient goes and they have the CT scan. Once the results come back, the nurse practitioners then review those CT scans. And if it looks good, they say, all looks well, Mr. Doe. We'll see you next year for your CT scan. So lung cancer screening CTs are so easy. And this is why we as lung cancer providers or individuals who work with people who develop lung cancer are so passionate about annual lung cancer screening, because a lot of people do not know that this free resource is available to them. And what we know is, again, early detection of these lung cancers significantly improves outcomes.
Awesome. Well, thank you so much for that answer, Ashley. And just thank you for your presentation. That is the end of our questions. So I just want to give you a thank you from myself and from our wellness team as well. I know sometimes talking about lung cancer or just cancers in general can be really scary, but I think you presented it in a really delicate way that everyone was able to learn some type of information today. So we want to say thank you from all of us today and everyone from on the call for all of your information and as well from what you do every single day as a provider.
Thank you. I appreciate that.
All right. As a reminder, we do have the resource member portal if you are on that Baylor Scott and White plan. Ashley mentioned some of those results, and maybe if you don't get that screening done, this is going to be a perfect resource as well if you're on that BSW plan to be able to see some of those live results in action as well, and maybe getting that lung cancer screening schedule for yourself as well, or getting that appointment scheduled with your provider just to have that conversation done for yourself. We do have a tobacco cessation program here with our health coaching team. It is going to be a one-on-one coaching program. It can be kind of split into two parts if you think about it. We, with the health coaching team, will do that primary like health education part when it comes to tobacco cessation. But if we work with a member and you continue want to be supported on your journey of quit smoking or tobacco cessation, you can continue to work with someone who does specialize in that area as well. So if anyone does have interest in that, you can visit our website or reach out to someone with the Baylor Scott White plan to definitely get you guys connected to that if that is something of interest to you. We do our webinars once a month, that first Wednesday of every single month. So you guys can join us back next month. They'll always be at that 11 o'clock hour. We'll have another interactive webinar. So if you guys joined us last month, we had our office fitness video. We're looking to do something a little bit similar next month, but next month you can join us on our meal prep and cooking demo video. So if you guys join us next month, you can get some tips on how to make meal prepping a little bit easier for you by using some common things that you have around the house. Thank you guys again for joining. We hope to see you guys again next month, and we hope you all learned something really important today. I hope you guys have a good rest of your week as well. Thank you.